So you will feel a little bit of tingling, and some people feel stinging, but it should be mild.
My name is Janna, and I'm 36 years old. Today I'm here to see the doctor to address my hyperpigmentation and age spots. I have concerns about my hyperpigmentation and some sunspots. I noticed it a couple of years ago, but it's definitely more noticeable in the summertime. I haven't done any treatments to address it. I just try and use like skin brightening face wash or moisturizer. I've been trying to look more into retinols to try and see if that can do any reversal of it, but I haven't really noticed a ton of difference. I always have to wear makeup, and I hate that because I don't like to look like I have a makeup face, but I'm so self-conscious about my hyperpigmentation that I will not go out of the house without makeup on. When I apply my makeup, I have to put at least 3 layers on, mainly on my forehead because that's where it's most noticeable, but to make my face look evened out, basically all over my face. I used to spend a lot of time in the sun. When I was younger, we would go to the lake every weekend and just be on the boat, and I would just wear oil and not sunscreen. And then I used to live in Phoenix, and so I'd always be out by the pool and just tanning. And then when I started noticing a little bit of the hyperpigmentation is really when I just was smothering myself in sunscreen, but the damage had already happened.
Hi, Tana.
Hi.
Nice to meet you.
Nice to meet you also.
So tell me what's going on.
I have hyperpigmentation on my forehead and some age spots and sun damage.
So it looks like you have melasma, which is a hormonal pigmentation. A lot of people have it. It's extremely frustrating. People get very frustrated with it because it's chronic and really hard to fix.
Yeah.
So usually it starts after a hormonal change, after you start the pill, stop the pill, or after you have a baby. And then there's a lot of people who get melasma just even if they never took any pill or had a baby, they just get it. So there is a genetic component. Do your family members have this?
I haven't noticed it on my mom. I've noticed some sun damage, but not necessarily the hyperpigmentation.
Okay. Well, it's not always familial, but it's always frustrating.
No. Yes.
One of the things that we recommend is that you do really strong sun protection. You have to wear hats, you have to avoid the sun and heat, because those are things that trigger the melasma. There's a lot of things we can do to make the pigmentation lighter. We can give you a skincare regimen. That's usually where we would start. And mild peels, very light peels. We don't want to be too aggressive with your skin because you can actually trigger melasma. If you do something really aggressive like a laser or a deep peel that causes inflammation, what ends up happening is you get a resolution of it. It looks really great, and then when it comes back darker and covers more area. It's a chronic condition. So that's the first and most frustrating thing to understand about melasma, is that it's not curable, it's only treatable.
Right.
Sometimes it goes away when menopause hits, when your hormones change. But we haven't really perfected what hormone change it is, so we can really correct it for you.
Right.
So we have to attack the pigment and tell you not to go in the sun, not to be exposed to heat, keep wearing your sunscreen all the time, use bleaching creams with retin A, and then some glycolics, and we have other tricks up our sleeve. We start with a series of very light peels. The Jessner peel is my favorite because it's non-inflammatory. So basically it's gonna make your skin peel off very lightly, almost like no one could tell you how to peel. Just enough so that any topicals that we give you in your regimen will get in really nicely and fade the pigment. Well, how do you feel about peels? Is that something that worries you at all?
No, it doesn't worry me.
No.
I feel great about them.
I feel great. I want peels. Okay. And then after we do a peel, and if we get you started on a retin A hydroquinone compound, we're going to ask you to strictly stay out of the sun. So is that going to be something?
I'll listen.
You'll listen.
Yes.
Okay, listen. And if you do have to go in the sun, you have to wear SPF 60 or higher, reapply every 2 hours. People with melasma will notice that even if they do everything right with their sunscreen, they go out in the sun, even with sunscreen on and a hat, that their pigmentation shows up more.
And that's just from the heat as well?
The heat and some UV must be getting in. That's how sensitive it is. So the Jessner peel is very mild. It was invented by Dr. Jessner in Germany many, many years ago, so it's been around forever. It's got 3 different active ingredients: resorcinol, salicylic acid, and glycolic acid. So it's 3 different ones, but they're buffered, so it's not a strong peel, like I said. The first step for the Jessner peel is we have to defat your skin, believe it or not. We use acetone to scrub your skin.
Like acetone, like the nail polish remover
That's
stuff
right.
on my face?
That's right. I know it's hard to believe, but if we don't do that, you're going to get an uneven peel, and only the sides of your face will peel and not your mid-face. And then I apply coats of the Jessner peel on your skin. And now that's the tricky thing about Jessner peels is you really have to be experienced, because some people take and are deep enough already with one pass. We just apply one coat of it and you're done. Other people need, up to 16 coats before they take. Yeah. Then after that, we neutralize the peel with a topical anesthetic that's actually alkaline. So the alkaline nature of it neutralizes the peel so it won't keep going deeper, so that way I have control over it, because I'm a control freak. But also because it has an anesthetic in it and it keeps it from stinging. So it stops stinging right when I decide to neutralize it.
Okay.
But having said that, it usually doesn't sting much. It just feels a little tingly, and I call it stingly, but nothing terrible.
Okay.
It's nothing like unbearable or anything like that. So Janna, you got defatted with that acetone. Was that a little bit rough?
It wasn't horrible.
So here we go. Whatever you feel, you tell me. If you feel a lot of stinging, let me know and we will neutralize it in sections. How are you feeling?
Feels fine.
It's starting to take on your forehead, I can tell, because the little salicylic acid crystals are on the surface. They turn a little bit white. I remember I was telling you some people need more passes and some people need less. Since we first started on your forehead, we can probably neutralize that sooner than the rest of your face, it looks like. Can you feel any stinging?
Very minimal.
Where? On the forehead? Or
No, actually more like on my lip area.
upper lip?
Yeah.
Okay. Upper lip is also sensitive right under the nose. So I'm going to neutralize your forehead. And that's one of your little trouble areas. And what's interesting about melasma is if you have any little scars from acne before, it doesn't go there, right? And so that it makes it look a little bit more patchy and white in those areas relative to the melasma around it. So that's why you see those little round little marks on your face, but they'll look less noticeable when we lift off the pigment surrounding it. All right, now it's looking like it's taking on your cheeks. You're doing great. So we're doing a decent number of passes on her because she has not had any peels and is not retinized or, using strong agents on her skin yet. So next time I see you, you'll have started the regimen we're going to give you that includes retin-A and glycolics and different things that help with pigmentation. So then probably it'll take a lot faster next time. Okay, so we're just rubbing in this numbing cream. We're gonna let her sit with it, and as long as she's not stinging, we'll take it off in a minute. And when you go home, you'll be a little bit numb. If you hate that feeling, wash your face with warm water and it'll go away faster. It'll feel tingly and it'll go away faster. And actually the very first day after your peel, you look amazing. Your skin looks really, really tight that first day. And then it starts peeling on day 2, which is usually just a little bit of flakiness that you'll notice, like a little bit of almost like a dry skin sensation. Is it stinging?
No, it feels good.
Feels good? Okay, so we are gonna take off the numbing cream now that it's not stinging, and then we'll put some sunscreen on you afterward before you go outside. Of course, sunscreen's your big thing now.
Yes,
Okay.
my best friend.
That's right. I'm going to give you some homework to do.
Okay.
And with melasma, like I was telling you, you have to do your homework or your pigment's going to not get better.
Right.
So I'm going to start you on a skincare regimen. I'm going to start you on a gentle cleanser. I love this one by SkinCeuticals because you just had a peel, so you really want to be gentle with your skin. You don't want to use abrasives or brushes or pumice or anything that scrubs your skin for the following week. Okay? So gentle cleanser, and then in the morning you're going to put brightening complex. This brightening complex does not have retin-A, but it has 2 different active ingredients that are going to help with pigmentation. Azelaic acid and glycolic acid. So those both will work in your favor in the morning. And then you're going to apply my favorite sunscreen, which we just put on you. I love this Elta because it's light, but it's a pretty high SPF 46. And so you can put it on and still wear your makeup over it or whatever you want. You can layer it nicely and it won't block your pores, cause breakouts, all that stuff. And then at nighttime, you're going to use that same main cleanser, the gentle one.
Okay.
And then you're gonna apply this prescription product. This is something we compound at the pharmacy. It has 4 active ingredients. So it has retin A, which is a vitamin A derivative, and it can make you peel a little bit when you first start using it. That's part of how it works. It also opens the skin besides the peel. So a little bit of peeling is totally normal because you had a peel and you're starting retin A.
Right.
Okay. And then it has hydroquinone, which is anti-pigment to help reduce pigment, and also kojic acid, which is another skin brightener. So we're kind of loaded all in there, right? And then I'm recommending SkinCeuticals Age Interrupter.
Okay.
Not because I think you have any aging issues, because you're so young and beautiful. No problem. It's just that this is the consistency of moisturizer that I like after peels. And that's it. 3 things in the morning, 3 things at night.
Okay.
Okay, and then I'm gonna see you in 3 weeks and we'll do your next peel.
Perfect.
All right,
Thank
I'm
you
looking
so
forward
much.
to
Me
it.
too.
You did great.
Thank you. Okay, so today is Monday. I had my peel done last Thursday, so it's been 4 days, and I just wanted to do a little update. I had very, very minimal peeling. I had like a tiny little bit on my nose here, but that's really the only spot I noticed it. What I have noticed though is just how much brighter my skin looks. And it's also super soft. Like my skin is so soft. It feels like a baby's butt. It's so soft. I probably shouldn't touch it that much, but I've been using the skincare routine that the doctor gave to me. I love the products. They're not heavy on my face at all, and they're making my skin a lot brighter and softer. After only 4 days and already seeing these results, it just makes me really excited to see what the next 2 peels will do for my face. Not wearing any makeup right now. I have on mascara, that's it. So you can kind of see like the hyperpigmentation on my forehead is still pretty prevalent, but also like the lighter my skin gets, the less noticeable it will be. And I just already feel more confident after 4 days, just bright. Like I feel like I'm glowing and I'm not wearing any makeup. So I'm excited to see what the rest of the results will be.
This is your second peel and you've been using the retin A with bleaching cream, so you're gonna notice it takes a lot faster and it'll probably sting a little bit more.
Okay.
And it's gonna peel a little bit more than the last time.
Okay.
But that's what's supposed to happen in this progression. You kind of go a little bit deeper with each peel. So this is her third peel, so she's gonna feel a little more stinging and it's gonna peel a little more.
So 5 months ago, I got my first peel here, and I've had 3 since, and I just absolutely love the results. I didn't think in 3 peels like it would do that much, and it's night and day. The hyperpigmentation in my forehead is significantly less noticeable. I didn't even really realize I had it on my cheeks until I was looking at other pictures, and seeing it now, it's so different. Like that has gone down, and just the general tone of my whole skin is so much better. I've really changed my habits a ton. Like I used to lay in the sun all the time, go to the pool, the ocean, and just want to get a tan. And now I stay out of the sun as much as possible. I wear sunscreen or a hat, but just try and avoid it in general. The process was so simple. I didn't notice anything. Like I noticed a little bit on my nose one time. And so that made me a little apprehensive because I was like, well, there's not going to be results because my skin's not peeling off my face, and the results are so much better.
Janna, you look great. How do you feel?
I feel so good. So great.
Oh, good. I'm noticing you have a little bit less pigment.
Yes, a ton less.
Not completely gone, but
Yeah.
better, right? What did you notice with the treatments? Did you feel like you got a lot of downtime, or how did you feel about it?
No downtime at all. I worked like the same day, same
Oh, really?
night. Yeah.
Yeah, that's what I do. I do those peels and come to work. So good. So you come back anytime you want and we'll do maintenance peels. I just want to tell you, you'll notice if you go on vacation or you go out in the sun a lot for whatever reason, or you forget your sunscreen even one day and you walk around somewhere, you might notice a lot more darkening. And then what I usually tell my patients is then it's time to do some cleanup work. Gotta do another peel and get back on your regimen. Just get back on it. It's like a diet.
Right.
Maintenance is everything. And if you go off the wagon, you just gotta reel it back.
Perfect.
So,
Well,
all right.
thank you so much. I love my face is so pretty.
I'm so happy for you.
Thank you.
I love it.